My name is Jennifer McKinnis. I am a program manager in our training department at Mama's Voices. And we're going to take some time today to talk about the importance of facilitating listening sessions to get a richer understanding of the experiences of patients in order for you to choose the types of quality improvement initiatives that are right for your organization. Every community is unique. Every patient perspective is valuable. Hosting a listening session can provide a really powerful opportunity to amplify the voices of patients with lived experience and ensure that their experiences are helping shape maternal health care within your own organization. So by bringing together patients and community stakeholders, you can do things like determine where are their barriers, where are their gaps in care. Patients offer a firsthand insight into the challenges that they face during their pregnancy, and they can help you identify areas where systems sometimes fall short. A listening session can offer really rich qualitative feedback. Stories and lived experiences will help provide context that data alone just cannot do. And it really brings the heart and brings the human impact to the statistics that you might be used to looking at when you're making decisions for your organization. And then lastly, the whole point of the listening session is to identify solutions based on what your community's needs are. I think we all want patient-centered solutions so that we can address the populations that we serve. Listening is the very first step towards action, and a listening session helps to create a space for patients to openly share and be honest about their needs. Before we dive into how to host a listening session, what you are looking at on your screen is actually a QR code that will send you to a new SUD resource hub that Mama's Voices has recently launched. And this is a curated collection of resources and tools from trusted partners who are also working in the maternal health space. Some of these resources were created by Mama's Voices, and we're going to talk about one of those today. So we are going to focus on how to host that listening session. And there is a resource in there called Hosting Listening Sessions, Best Practices and Key Considerations. And so today we're going to walk you through many of those best practices, but this is just a small peek of what's included in that resource. Where did this resource come from? We created this through a partnership with our Mama's Voices team members and a work group of patient family partners with lived experience in SUD. And the resource will include things like sample supply lists, a planning checklist that is broken down with a suggested time frame. We'll include a sample agenda and even a list of trauma-informed discussion questions that you can use during your listening session. I'll show a few screenshots today, but we encourage you to dive into that SUD resource hub and download this entire document. One of the first decisions that you will have to make when you're planning your focus group is what format is right. Whenever possible, we recommend you offer multiple options, and that'll increase opportunities for people to participate. So we've got 3 different options listed here. You can hold an in-person session. It's a great way to build trust, to encourage really deep conversation. Face-to-face discussions allow for that deeper connection between participants and a lot of reflection. And the facilitator can have the opportunity for very authentic interaction with the participants. You also could host a virtual listening session, and that really offers flexibility. It's accessible by a lot of people, and it can eliminate a barrier like transportation or scheduling conflicts. And of course, one of the biggest benefits of a virtual session is you can reach a broader audience and a more diverse set of experiences. And then the last option here is consider partnering with a community organization. We encourage that you partner with a group that might already be embedded in the community and might have existing trusted relationships so that they can help you to create a comfortable environment for participants to share. Each of the formats has unique benefits, and choosing the right one will really depend on who's your audience, What are your goals? And of course, what are the resources that you have available to you? So let's dive into planning for your listening session. Thoughtful preparation can make a huge impact on participation. So here are a few considerations. Your location is a really important one. You want to choose a welcoming, accessible space. Think community center, think library, think of a facility that is on the route of public transportation. Consider offering childcare options and transportation assistance, maybe a bus pass, anything that you can do to remove a person's barrier to participate. We want to make sure all voices have the opportunity to share their experience if they want to be a part of that type of QI work. How are you going to recruit? Try connecting with trusted networks like community-based organizations. Doulas are such a great resource. SUD recovery groups, harm reduction programs, treatment centers, NA or AA meetings, community health workers are another really great opportunity to connect with individuals with lived experience. When you're choosing the size of your group, you want to take very careful consideration. More people does not necessarily mean better quality feedback. Smaller groups might actually encourage a deeper conversation, and it'll allow participants to feel heard without them feeling like they have to compete with other people to share their voice. And then the last thing to consider is compensation. If you can provide any kind of incentive, we encourage you to do that. It helps increase participation. Some people will have to rearrange their personal lives, their professional lives. They might take time off of work, or they might have to find childcare in order to participate. And one last note about that, if you can issue an incentive real time during the session, just something easy like a gift card, that's really appreciated by patients with lived experience because they're not having to wait in order to receive that incentive. The most important takeaway on the front end of planning your listening session is try to anticipate those barriers to participation and try to remove them if you can. The more accessible, the more inclusive your session, the more meaningful and actionable this event is going to be for all of you. Before we begin any listening session, it's really important to set the tone. So you want to create a warm, welcoming, inclusive space where everyone feels comfortable sharing their experiences. So here are a few strategies that we would suggest. Simplify that check-in process. We want to make the process really smooth, stress-free. Can you combine a sign-in form with the consent form to reduce the paperwork? The faster you can let them come into the room and get settled, the more comfortable everybody is going to be. Can you have a friendly greeter at the door who can help them feel welcome from the moment they step into the room? We talked about this idea of a children's room. For parents and caregivers, that childcare really can be a barrier. So when we held our focus groups, we provided a designated children's room where kids can safely play, but within view of the parents. There were actually glass windows, and it allowed parents to stay engaged in the conversation, but also know that their children were close by and were safe. Some of the parents who had delivered recently actually kept their infants in the room, which was really special. Be thoughtful about the room layout. Instead of a classroom setup, maybe consider arranging your seating in a circle or a U shape, some type of layout that will promote more open discussion. And of course, who doesn't like drinks and snacks to make themselves feel comfortable? So build in scheduled breaks to make sure everybody remains comfortable, but also is able to remain focused throughout the session. Listening sessions can be very emotional. If you have the ability to provide a quiet relaxation area, think comfy seating, think calming music, maybe like fidget items, fidget spinners, an area where participants who need to can kind of step away and recharge. Remember, at the end of the day, we want a space where everybody feels valued, they feel supported. And that welcoming environment is the first step to meaningful conversation. So let's talk about your agenda. A well-structured agenda is really critical to encourage a nice, strong, rich dialogue. So we have included a sample agenda in our resource of how we structured our focus groups. And you can see the screenshot on the right actually includes options for both a virtual and an in-person session. And we conducted both of these and tried to kind of choose the best practices of our own experiences hosting listening sessions. So you want to start with that facilitator introduction, and it sets a nice welcoming tone to match that welcoming space. The facilitator should introduce themselves and be really transparent about the purpose of the session and what the results of the session are going to be used for. Build in a warm-up activity. Start with something simple, a nice little engaging activity to help them feel comfortable and meet each other. This could be a quick icebreaker, or it could even be a reflective prompt related to maternal health to kind of get their brain juices flowing. How you just structure your discussion is going to be critically important. So you want to go in with a very intentional questioning process, and we're going to share very specific suggestions about that today. We recommend offering different participation options to accommodate different comfort levels. And then, of course, how you close the session is just as important, and we're going to offer some suggestions about that as well. So at the end of the day, you want to start with that structured approach, but you also want to be somewhat flexible and adapt if you need to. Go in with the plan, but don't be afraid to pivot. So let's talk about the discussion portion of the event. It's the whole reason why you're having this event. Effective facilitation is key to making sure participants feel respected and feel empowered to share honestly. And that starts with deciding who is going to be facilitating your session. For ours, we chose to have a pair of people leading the group. We chose one very skilled facilitator, and then we chose a person who was a community liaison, someone who already had strong existing relationships with people in the community. So we're going to share some best practices for guiding your discussion. You want to continue to create that safe and inclusive environment. Set the tone by establishing ground rules for everybody that's in the room. Make sure you're promoting respect, confidentiality, non-judgmental listening. And then you want to start to build trust by being transparent. We mentioned earlier, clearly explain the purpose of the session, why they have been invited here, and how their feedback is going to be used. You want to actively listen and include follow-up questions. Show genuine interest. Consider rephrasing their responses back to them. It confirms that you've heard and understand what they're saying, and it also validates their experience. Don't be afraid to ask clarifying questions if you need to. You want to make sure you use discussion-provoking questions. So frame questions to encourage storytelling, deeper reflection. Open-ended prompts will almost always allow for more richer insight. And then lastly, you want to make sure that your facilitator is managing time and the group dynamics. Keep that discussion balanced. Make sure all the voices have an opportunity to contribute while staying on track with the agenda. As for communication, your facilitator should be using trauma-informed language. Show empathy and compassion throughout the conversation. And we would suggest allowing participants to self-identify in terms of how they refer to their experience. For example, we might say a person with lived experience in substance use disorder. Another person might choose to refer to themselves as a person in recovery. Pick up on those cues of how they refer to themselves. As for the topics of the discussion, we won't go through those today during our training session, but we have included in the resource a list of discussion questions if you're looking for ideas, and they are split up by topic. So we have questions about pregnancy and prenatal care, childbirth and hospital experiences, postpartum and parenting support, barriers and stigma, family and community support, and solutions and advocacy. Some of those questions are intended for patients with lived experience in SUD, and many of them would apply to all types of lived experience. We encourage you to borrow any questions that you like. So how will participants provide feedback to you? We recommend offering more than one option. For example, let's say you were holding a virtual listening session. You pose your question to the group. Perhaps you ask them to reflect a little bit on it. Have them all respond in the chat so they are writing out their responses. Give them some time to read each other's responses and then open up the floor for verbal comments. So they can either share about their own response if they wanted to, or perhaps they want to reflect on someone else's response. Maybe they read something that really speaks to them. Let's say you're holding an in-person session. Consider asking your question. And of course, they could reply right away with a verbal response. But here's another alternative. Ask your question, encourage them to write their answers down on a Post-it note after a little bit of time for reflection. Invite them to hang their Post-it notes on a wall or a whiteboard. This allows anonymity for those that perhaps want to maintain privacy about some of their responses. Then invite your participants to participate in a gallery walk where they read all of those Post-it responses, and then open it up for discussion where they can speak about their own response or they can speak about someone else's. So we're talking about different options of participation, written, verbal. We would recommend also offer them the opportunity to share thoughts after the event is over, in case other ideas come to their mind later on. So they've got all these options of how they can share their feedback. Now the responsibility is on you. How are you going to collect the feedback? You can have a designated person who is recording, or in our case, at one of our in-person listening sessions, we had a visual recorder that was identifying themes throughout the event on a whiteboard. And you can see the image on the screen on the top right is actually our visual recorder in action during our event. So now let's assume you've completed your discussion and it's time to wrap up. What does this look like? Closing out your event is as important as how you opened the event. So what's that going to look like? Show appreciation now while they're in the room, and then later on with a thank you note. Send them away with local resources or maybe self-care suggestions. Share about future opportunities that you might have coming up that could include an opportunity for a patient voice. For example, let's say you know that you've got a work group that's being put together. Perhaps there's a patient advisory council that someone might be interested in joining. Distribute a quick survey to collect feedback. And of course, feel free to give them contact information if they have any follow-up information they want to share with you. What happens after your listening session is over? You've closed your event, your participants have head home, but that's not where your work ends. You now want to consider everything that you learned during the event. You want to identify key themes. So review your participants' feedback, identify any reoccurring concerns, reoccurring barriers. Where were there opportunities for improvement? Categorize those insights into themes. So things like maybe access to care, provider communication, or health equity. Next up, determine what actionable change will look like for your organization. So identify specific feasible improvements based on the themes that you learned from your listening session. And this is where you're going to have to try to prioritize changes that align with your PQC goals and with the unique needs of the community that you're serving. And then it's time to begin the project planning process. So narrow down your objectives, develop a timeline for your projects. What are you going to implement now? What's going to be after that? What's your long-term plan? Assign responsibilities to keep initiatives on track. What resources do you need in place to bring this to life? And then, of course, lastly, don't forget to share insights with your key stakeholders. So make sure you're presenting your findings to healthcare leaders, to the community partners, all of the folks who are helping you bring this actionable change to the community.